Welcome to the Deep Dive. Today, we're tackling something really, really important for making healthcare work better for everyone. We're talking about quality champions.
hmm
These are the people who can, well, really unlock better patient care and safer systems.
Absolutely, they're key.
So we're going to explore what actually motivates these champions and, maybe more importantly, how organizations can, properly support them and keep that fire lit.
Exactly. And we've pulled together some really solid insights for this. We're looking at information from Joint Commission International, JCI, the global authority,
Right.
and also the National Accreditation Board for Hospitals and Healthcare Providers, NABH, plus Supremediq Consultancy and ISQA, that's the International Society for Quality in Healthcare.
Nice squawk.
Yeah, pronounced ISQA. And we've also looked at various articles specifically on motivating these key people.
Okay, great. So the idea here is really to help you, our listeners, understand how you can build a culture where improvement isn't just a goal, but it's actually happening day in, day out.
By empowering the right individuals.
Precisely. Okay, so let's start at the beginning. When we say quality champion, what kind of person are we actually picturing here?
Well, the QI playbook gives a good definition. It's not just someone who, likes quality improvement.
Right, more than just good intentions.
Much more. They're active advocates. They push for QI initiatives. And interestingly, they often drive change through influence, not necessarily formal power.
So they don't need to be the boss.
Not at all.
Yeah.
They model the best practices, they live it. And they're crucial for sort of bridging that gap between what staff see on the ground, the daily struggles, and what leadership is trying to achieve strategically. They connect those two worlds.
That's fascinating. And the playbook mentions they can come from anywhere, right? It's not just doctors or managers.
Absolutely anywhere. Could be a nurse who sees a better way to manage patient flow, a lab tech who's really focused on safety protocols, an administrator, anyone really committed.
So it really highlights that quality improvement starts everywhere, on the ground level.
But as the playbook points out, you can't just run on passion forever, can you? Motivation is key. Otherwise, these people burn out.
Precisely. That initial spark needs fuel. And when we look at what provides that fuel, several things really stand out. These are echoed in the playbook, but also align with the thinking of JCI and NABH.
Okay, like what?
First off, purpose. A really strong sense of purpose. Champions need to see the connection between their work and better patient outcomes.
Tangibly see it.
Yes, tangibly. How their efforts lead to safer care, maybe better staff morale too. It links directly back to JCI's big vision, zero harm, high reliability.
Right.
And also NABH's goal of setting those quality benchmarks for hospitals. Seeing their work fit into that bigger picture is hugely motivating.
That makes perfect sense. You want to know your hard work actually counts for something meaningful.
Right.
What else drives them?
Recognition. It's incredibly powerful. And it doesn't always have to be some huge award ceremony, just publicly acknowledging wins, even the small ones.
Like a quick shout out. Exactly. A sincere thank you in a meeting, maybe a QI Star of the Month feature, a formal award. These things really validate their effort. Some studies even suggest, specific recognition can really boost engagement significantly.
I like that focus on small wins. It keeps things moving, shows progress is actually happening, right?
It really does. Builds momentum.
Okay, so purpose recognition.
Right.
What about giving them some control? A sense of ownership?
Yes. Autonomy. That's critical. These champions often have great ideas.
Yeah, they're the ones seeing the problems up close.
Exactly. So giving them the space, the freedom to actually test those ideas.
Yeah.
Maybe using something structured like PDSA cycles.
Planned doses study app.
Right.
Yeah.
That systematic way to try small changes, see what happens, adjust, try again. Giving them room to maneuver, to adapt processes based on what they learn. That's vital. Being too rigid can just kill their enthusiasm.
So trust their insights, let them experiment a bit. That sounds empowering. What about their own growth? Learning new things?
That's the next one. Mastery. It's a really powerful internal motivator. When an organization invests in their learning.
It shows they value the person, not just the task.
Precisely. Offering access to certifications, helping them get to conferences like ISQA has its big international conference coming up in Sao Paulo, October 2025.
Oh, right.
Or setting up mentorships. It all helps them grow their skills. And this aligns perfectly with ISQA's whole focus on education and sharing knowledge in the quality community.
So it's a win-win. They help the organization improve and they build their own expertise.
Nice. What about connection? Feeling part of something?
Belonging. Absolutely essential. Creating a community, even just an informal one, of QI champions within the organization. It provides massive peer support.
A place to share wins and maybe vent frustrations.
Exactly. Share successes, but also talk about the roadblocks, the challenges, which are inevitable. Organizations like ISQA and NABH foster that sense of community on a bigger scale, nationally or globally. You can mirror that internally. It really does sound like you need a whole support system for these champions to really thrive long term. Okay, so let's get practical. Based on the playbook and the other sources, what are some concrete things hospitals or clinics can actually do?
Okay, well, a foundational step is to actually formalize the role sometimes.
Give it a proper name.
Yeah, like Department QI champion. Define what's expected, maybe even include it in their performance reviews. That sends a clear signal. This work is valued. It's part of your job.
Right, it takes it out of the nice-to-have category and makes it official.
Exactly. Then think about structured recognition programs. Maybe quarterly awards for good projects. A visible wall of fame.
Somewhere everyone can see who's doing what.
And making sure senior leaders regularly and publicly acknowledge their work. That leadership visibility is huge for morale.
That theme of public acknowledgement keeps coming up. What about more tangible rewards?
Incentives can definitely help. Things like paying for them to attend workshops or courses, maybe even small bonuses tied to successful projects.
Investing in their skills again.
Right. And this is where resources like, say, Supremediq consultancy could come in. Maybe they offer specific training or help with NABH implementation that these champions could really benefit from. It boosts their skills directly.
Okay, so investing in their growth, recognizing effort tangibly. How do you make sure their actual projects get seen?
Celebrating the projects themselves is vital. Give them platforms.
Like a presentation day.
Yeah. Hospital-wide QI days, patient safety week presentations. Let them share what they learned, what worked. Use the internet, bulletin boards, get the word out about their successes.
Sharing those stories could inspire others too, couldn't it?
Absolutely. It creates a ripple effect. People see what their colleagues are doing and think, hey, maybe I could try something similar.
Okay, one last really crucial resource, time. How do you manage that? Healthcare is notoriously busy.
Protecting their time is non-negotiable, really, if you're serious about QI.
So carving out dedicated hours.
Yes. Allocating specific time just for QI work, separate from their main duties. Dr. Sheik in the playbook gave that example, maybe 4 hours a month. Dedicated. It shows organizational commitment.
It says, we trust you and we value this work enough to give you time for it.
Exactly that. It's a powerful message.
Okay, so bringing all this together now, stepping back for that expert view, what's the big picture on keeping these vital people motivated?
Well, I think the main thing to stress is that this isn't a one-off checklist. Motivating champions is it's a continuous process and needs ongoing effort.
Not set it and forget it.
Definitely not.
Yeah.
And leadership is absolutely fundamental. They need to create and actively maintain a supportive environment where QI isn't just, jargon.
But actually part of the culture.
Right. Champion from the top down, walk the talk.
So leaders need to be visible and committed. What else?
Measuring and communicating results is critical. You have to show the impact.
Show the data.
Yes. When champions see clear data infection rates dropping, patient satisfaction improving, processes getting smoother because of their work, well, that's incredibly powerful reinforcement. It closes the loop and fuels more effort.
Makes it real.
And one final point, even something like going for JCI accreditation, that whole process can actually help quality champions indirectly. It forces better teamwork, better communication, gets everyone focused on quality standards.
So the accreditation journey itself builds a supportive structure.
It can, yeah. It becomes a shared goal that lifts everyone's game, including the champions.
So it's all linked: leadership, showing results, collaboration. Okay, let's wrap up this deep dive. What's the single most important message you want people to take away today?
I think it's this. Motivated quality champions are, but they're indispensable. Absolutely essential for real, lasting improvements in healthcare quality and patient safety.
Can't do it without them.
Pretty much. Their passion gets them started, but it won't sustain them alone. They need that tangible support, the recognition, the resources. Otherwise, burnout is a very real risk.
So nurture that passion.
Yes. And celebrate the wins, even the small ones. And importantly, treat the setbacks not as failures, but as learning opportunities. That's how you build that positive, forward-looking QI culture.
That's a great summary. Okay, so here's a final thought for you, our listener, to chew on. Think about your own workplace, your own sphere of influence. Who are the people there who just naturally seem to spot problems and want to fix them? your informal champions,
Hmm.
are they actually empowered? Do they feel supported to make those changes happen? Or are they maybe hitting roadblocks? What's one thing, maybe even a small thing, you could do today to better support one of those individuals?
Good question to ponder.
And if you want to learn more, definitely check out the resources from JCI, NABH, and iSquad. They have a wealth of information. Thank you for joining us for this deep dive.